Thanks, everybody. I did want to start out by just giving a few words of thanks for this entire event. I know that some of us may have to filter in and out as the discussion goes on. So I did want to make sure that I gave a few closing remarks today, this afternoon, before everybody starts jumping off. So I want to first thank Dr. Betty Goldentire, our former deputy administrator. She was the one who first heard that these questions were out there and that she recognized that somebody needed to start having this conversation. And so with her support, we did start having these conversations. I was able to reach out to Mike and start having the Pet Advocacy Network host and assist us in reaching out to the community as a whole. Dr. Theodorson, our assistant deputy, she's our head of our collaboratory group, who is also overseeing the Center for Animal Welfare, and her support. Dr. Martha Keller, the director that I mentioned this morning, as well as Dr. Jeannie Lynn, our assistant director, for all of your leadership, management, learning as we go, and helping overall guiding the ship as we navigated so many questions that we never thought we'd need to learn to be able to put these events on. And then everyone else who took part in planning this event. Dr. Dawn Fitzhugh, she's outside of our center group, but she's part of our national policy staff. She came on halfway through, but jumped in with both feet, helping fill the gaps and stepping up to the tasks that needed to be accomplished to be able to bring this event for everybody. Chad Moore, our transportation specialist, thank you for going first and letting me learn from your experience and being my constant cheerleader and telling me that everything will be okay. And the rest of my fellow field specialists, just for being there and supporting all of us as we were going through this, being a sounding board and being patient with all of us when we were consumed by all these planning tasks. Just want to recognize that Lori Gage, Gwen McGinnis, Cody Yeager have all done amazing things this year, in addition to these symposia. So you've been amazing. I haven't properly recognized or congratulated you individually for your accomplishments. So I just wanted to take this moment to say, I see you and appreciate you. And I want to know that you're all doing such great work. Thanks to Dave Prouty, our Zoom host extraordinaire, Karen Lang and Rania Galachner for all of your hard work back in the background. We had a lot of scrambling going on this morning, and I don't think anybody else appreciated that other than those of us who were behind the scenes. So that was really great that you all pulled that off and got it together and made sure that everything ran smooth. And lastly, but certainly not least, Shannon Sabera. She has touched every part of coordinating almost everything about this two-day event. I have worked with Shannon for years together when we were inspectors in Ohio. Shannon, I knew you were always a workhorse, but she has certainly taken things to a whole new level. You are definitely a rock star, and I'm so thankful that you're here with us. Next, I want to just thank all of our speakers. Dr. Roxanne Mullaney, our newly appointed deputy administrator, for kicking us off and for your continued support of our work. Bob, Christina, I know how busy you are getting all of your inspections done and going back time after time to each of those facilities who are struggling, and you really don't know how to help them other than just telling them the same things over and over again. I know how hard that can be. So I truly applaud you. You are the front lines, the voice, the image of animal care out in the field. You were the first ones to raise this issue to my attention, and I guess the rest is history to lead up, at least up to today. I also just want to take a quick second to recognize that Bob Markman has been with animal care for almost as long as I've been alive. And he's been recognized multiple times over for how the most inspections done in a year. We were joking back and forth about how he can never give up. So just thank you, Bob, for doing what you do, for doing it as long as you have. You're a stalwart and a legend. And Christina, not to be put aside, you, I know, also are so busy, and you're right there alongside him. I know you don't have quite as much tenure, but you're the next Bob. Special thanks to Mike, like I said, for hosting with us, beginning this conversation. The Pet Advocacy Network was key, and as you had mentioned before in your talk, it's important that we are all part of this conversation, because even though we might have different opinions about certain issues, we all must be present and participate to be able to find a solution. So I'm really thankful to you for your partnership and collaboration and dedication to making these conversations more inclusive. Dr. Hart, you did a fantastic job of illustrating, some of the complicating factors when it comes to serologic testing, and it's not just a one size fits all. This is how we should do things, and everything will be okay once we find out the answers. That's definitely not the case, and it's not the situation that we found ourselves in. And I thought you did a great job summarizing that and painting that picture for us. And I hope that we can move forward to learn more about the impact of this disease and developing some more diagnostic options. Dr. Ritchie, thank you for also being there from the beginning, providing such a comprehensive review of what we know, which is really quite little. Definitely appreciate you framing all those questions to outline the process it would take. And in the end, there's a lot of work to be done. Hopefully just talking more about it today and over the course of the conversations that I'm sure will come in the future, we'll get more interest, get others involved, and hopefully share some of that workload. So as we approach the panel discussion, I want to pull up what it's going to look like for everybody. So we do have some questions that have already been received. And so we'll have one of our hosts ask the question. They will ask each of us panelists to comment, and then it will become open to the rest of the audience. If you have a question or you want to make a comment, please use the chat or the reaction button to raise your hand, and then the host will unmute you. Panelists, it's the same for us, so we're not talking over each other. If you are wanting to respond to an audience member's comment, just put your hand up so that we have a little bit of order. But otherwise, I think we're ready for our first question.
Awesome. So Kathy, I'll let you take the first comment on to this question. What steps can the guinea pig industry take to ensure the welfare of the animals as well as success of the industry?
You had to pick me to go first on this one. I think, we've kind of touched around it a little bit, and I think I would harken back a little bit to what Mike talked about as far as becoming a network and being able to be reached as an entity. As a regulatory agency, and Roxanne alluded to it this morning as well, we can't do our outreach based on a targeted facility. So we can't say, hey, you need help, we need to give it to you. We have to do it across the board and consistently. So I think that's the two things that I would say is becoming more consistent across the board, and having a network of to be united and move things forward as a whole.
Okay, thank you. Dr. Radzai, same question.
I think one thing that would help would be improved communication between, brokers and breeders, as far as, and I think that's something that Bob brought up, if things are slow, if they're not going to be picking up, keeping breeders in the loop as far as that goes. I think communication was a bit of an issue with the e-cuniculi, because breeders just saw that the brokers weren't picking up. There really was not a lot of communication in the beginning. It was kind of piecemeal. So you have breeders kind of left in the lurch. Do they keep breeding their animals? In the meantime, you have overcrowding, so that, impacts the welfare for all the animals. So I think, strengthening that communication a little bit, I think would be one thing that would help.
Okay. Bob Markman, you're up next. Same question, sir.
Well, I have to agree with Christina on the brokers not and breeders not communicating well. But I also think the price is too low right now. I've had several breeders tell me that they can't even break even paying their feed bill for the last 2 years. So this price of $5 or $6 is little incentive to stay in business. And even with more than half going out of business, you would think the price would stabilize. But even this summer, there were threats of lowering the price even more. Not picking up for weeks or months is really difficult because breeders are expecting the broker to pick up every week. And if it goes to 2 weeks, they can deal with that. But oftentimes by 3 or 4 weeks, now the weanling is too big because they normally want them between 250 to 400 grams. Some of the brokers only want them between 250 and 350 grams. So for most of them, once they get too big, by about 4 or 5 weeks, now they have to save them for future breeders or try to get rid of weanlings. And it's very difficult to get rid of weanlings unless they're going for the pet trade.
Thank you,
So I
Bob.
think we need to come up with a better price, or at least the brokers have to come up with a fair price that these breeders aren't losing money.
Thank you, Bob. Mike Bober, sir, you're next.
I think at this point, a lot of the good answers have already been taken. And if there were more good answers, hopefully folks in the community would already have them. But I would say that I always go back to the twin pillars of communication and transparency. So to the extent that there can be better communication in all directions, breeder to distributor, distributor to breeder, retailer to distributor to breeder, and then also within the regulated community as well. I think that really puts everybody in the best possible position to kind of move forward with better information.
Thank you, sir. Dr. Hart?
So I concur with everything that's been said. I echo the transparency and communication. I think the layer that I would add is, I think kudos to everyone to putting this symposium together, because I think things like this, where you get multiple viewpoints, are really, I think, informative and important. And that they also help us define the goals. I think it's important that we all define the same goals on what are we trying to achieve here, especially when it comes to the health monitoring and what do we monitor for and how do we get there, and just making sure that we're all kind of moving in the same direction together.
Awesome, thank you. Dr. Ritchie?
Yeah, I think I'm going to say a summary statement that backs us up 40 years to the transition into what we now classify as managed populations of companion birds to the benefit of consumers, the retailers, and the entire system. And that is who pays for a seat belt and who pays for anti-lock brakes. And of course, seat belts and anti-lock brakes have great merit, as does the prevention of diseases, particularly if those diseases can be transmitted through people or into other populations of animals. And I think that model has worked, where the standards were set. In some cases, they were regulated. That was the best ones that could be done. In the case of the compendium, we set a standard of care that others could choose to follow or not follow, but it's very problematic if you don't follow that standard of care. So that was done without the regulatory component. And then everybody in the industry is playing from the same playing field. So if you raise the price of a guinea pig by $2 to make them healthier, better, happier conveyors of the human animal bond, then everybody who's subscribing to that standard is having to pay that same cost, and therefore nobody's at a competitive disadvantage. I think it's worked. I think it's worked well, and I think it's a model we should follow across the platforms of creating that a happier, healthy guinea pig and a happier, healthy child that engages with them.
Our panelists had lots of good comments, and so now we're going to open it up to all of our attendees. If you would like to put in a comment on how you think that the guinea pig industry, we could ensure the welfare as well as the success of the industry, please raise your hand and you'll be called on. We'll unmute your microphone and you'll get to answer or ask or make a comment. The question is, the concerns for what E. caniculi could do to the health of people has led to the downstream effect. Like breeders ending up with guinea pigs with no place to go. What lesson can we learn from this?
I'm sorry, I lost you on the last part of the question.
Sorry about that. The concerns with what E. caniculi could do to the health of people has led to the downstream effect of breeders ending up with guinea pigs with no place to go. What lesson can we learn from this?
I think the lesson that we learn is that we have to be careful in what it is that we say. We have to be careful in how we interpret information that we're presented and what that information may or may not mean. We have to remember that what we say and how we say it has consequences, and that in this case, that is businesses, it's animals' lives. Again, I reiterate, it could not be in a better form than the Center for Animal Welfare that we're dealing with the animal mortalities that have occurred because of decisions that were made based on this testing. The only way to correct it is to collect the necessary data, positive or negative. We'll at least know which way it is, and then we can effectively manage the risk and determine how we don't negatively impact the animals or the human-animal bond.
Okay, thank you. Dr. Hart?
I think it just underscores the importance of communication. And, if there's an issue, to get the right groups together to help address the issue, and where do we move forward, and figuring out what that common goal or common scenario is, because like was kind of mentioned before, that there are consequences one way or the other, and there are different perspectives on both sides of a discussion. So I think communication for these types of things is key.
Thank you. Mike Bober?
Yeah, I think one thing we kind of need to be watchful for in situations like this is that, in a lot of cases, there are unintended consequences that come from well-intentioned actions. But I think it's also worth noting that sometimes those consequences are very much intended by people who choose to misrepresent or exaggerate elements for their own purposes. And so I think we have to be really careful in all situations to make sure that everybody is approaching a conversation in good faith. If somebody's coming in with their own agenda, and if they say one thing in a group setting and then turn around and badmouth the other participants, for example, that can very much poison the outcomes, and then we end up with situations where the unintended consequences were actually very much intentional.
Okay, Bob Markman?
I think in this particular situation, we didn't always know what we were dealing with, whether we were in the field inspecting these facilities, or the breeders, or even in some cases, the brokers really didn't know what we were dealing with, because we were dealing with a slow market. We were dealing with just a summer slump when people go on vacation. It wasn't until almost the fall of 22 that it leaked out that the reason they weren't picking up was E. caliculi. So I wish we could have communicated that earlier. I know in July of 2022, I reached out to other inspectors in the country and who had brokers in their area. Please have your brokers talk to the breeders. They haven't picked up in 6 weeks. We're seeing a lot of non-compliances up here. So, you know, after a while, we started getting weekly calls just saying that they weren't picking up. It took another month to actually find out that they weren't picking up because of E. curricula. I wish we could have known that in June of 22. So those extra couple months, and for some breeders, they didn't get the message till October or November of 22. It was a difficult time to tell these breeders or try to give them advice what to do. And I think a lot of our veterinarians weren't sure. Should they test 20? Should they test 1 in each pen? Different brokers were requiring different things. And even though we had some calls in the fall, there wasn't a unified effort. So going forward, I'd hope we'd have a little bit more contact with these brokers to get them back on the phone.
Okay, thank you. Dr. Radzai.
Yeah, I think just being careful about making decisions without all the information. I think that happened quite a bit in this situation. There were a lot of confusion about what tests to be using for E. cuniculi. Are the tests accurate? You know, should you be sampling blood or urine? How many animals should you be sampling? And decisions were being made based on, you know, not knowing if these tests were accurate, if you were testing enough animals. You know, brokers stopped picking up from those breeders. Those breeders went out of business. Those animals had to be euthanized or, you know, go somewhere else. So there were serious consequences. I mean, I understand the importance of human health. I understand that concern. But just listening to Dr. Ritchie and kind of the data that he has gone over, you know, where are the human cases of E. cuniculi that is causing such a reaction that is leading to loss of business and, you know, loss of the lives of these animals. So I just think being careful to make decisions based on science and based on, you know, complete information is important.
Okay, thank you. Dr. Campitelli?
Yeah, I agree with everything that's been said so far. In addition, you know, I think that there's definitely a parallel that we can draw with other industries that have been affected severely. Like you could take, you know, foot and mouth disease in the UK, Newcastle disease in California. These severely affected the animal industries in a way that some might argue was necessary, but there was a proven risk associated with those disease agents that we haven't really proven yet for E. cuniculi. So I think one of the biggest lessons is, you know, a knee-jerk reaction can be appropriate, but it needs to be tempered with information gathering. So a stopgap measure should not be the first and only intervention that occurs to help control a problem.
That came in. Thank you, Dr. Campitelli. We do have a comment that came in the comment section, and so Dave's going to read it for us.
Sure. It says, is it time for a shift in terminology, starting with the word zoonotic? More often than not, medical professionals and health literate lay people interpret zoonotic as a disease that only comes from animals, too often accompanied by, so get rid of the animals to solve the problem.
Okay. Do we have any panelists that want to comment on any of that? If so, please raise your hand. We have one, Dave. Dr. Ritchie. Dr. Ritchie, go ahead and unmute yourself and answer, sir.
I couldn't agree more. And I think that it plays into the question I got asked about why the difference in the human versus veterinary literature and the description, which if if we run out of questions, I'm going to ask colleagues to weigh in on why they think there's that difference. It's also why I brought in the welcome.org comment on 58% of 1,400 human pathogens being classified as zoonotic. That means we need to separate rabies from a prion disease from a ubiquitous spore. And it does need to change. We need to think about changing the definition, coming up with a different word that describes it differently. If you look at the definition of zoonotic, it's just a organism that moves between animals and people. And if you use that definition, I'm surprised it's only 58% of the human pathogens are zoonotic, because most pathogens can move between species. So now you're just down to a limited group of viruses that have specific cellular receptors that it takes to get into a host, or a specific group of parasites that have intermediate hosts that aren't people or aren't a particular animal that comes in contact with people. So I think we have a serious definition problem.
Awesome. Thank you. Dr. Radsai?
Yeah, I agree. I think the intention of saying zoonotic is, a person is getting a disease from, directly from an animal, but there's so many situations where, a bacteria can infect a human and it can infect an animal. Do we know if the human was infected from the animal? I would say a lot of cases, no. Like with E. cuniculi, it's everywhere. It's in the soil, it's in the water, it's in lots of different animals. So I just question the ability of someone who has a guinea pig and who gets E. cuniculi to prove that they got it from that guinea pig when it's in dogs, it's in cats, it's in, the soil, the water. So I definitely think looking at that definition, we're using it to capture probably more than what we intend to with it.
Awesome. Dr. Campitelli?
Yeah, I also agree with the sentiments that, zoonotic or pinning the problem on animals has historically been unsuccessful. We've seen it with monkeypox, where the terminology is changing so that people are not associating it with monkeys in particular, because there's a backlash. People were slaughtering monkeys in Brazil because they were afraid of yellow fever. So there's, different aspects of the terminology can be changed and adapted so that you don't have that immediate gut reaction of, well, get rid of the problem and it solves the problem. The other thing that I want to say about that is I do think that the growing push to embrace a One Health concept, I think, is encouraged, and it should be, we shouldn't be dealing with zoonotic because we're leaving out the environment at that point. So if we're talking about an organism like E. cuniculi that is everywhere, it is truly a One Health concern. It's not a zoonotic concern. It's not an anthropozoonotic concern, human to animal or vice versa. It's a One Health concern because it is truly everywhere.
Okay, thank you, Dr. Campitelli. There has to be more people on here that have definitely been impacted by this. We'd like to hear something from you. What lessons have we learned, or what lessons can we learn from this? If you'd like to make a comment, please raise your hand. If you don't want to ask a question to be unmuted, please use the Q&A session and we will answer, or we will ask the question for you. Dr. Ritchie?
Yeah, while we're waiting, colleagues, anybody who wants to weigh in, why the dramatic difference between terminology in human literature and veterinary literature?
by raise a hand. Panelists? Anyone out there in the attendees? Kathy or Dr. Campitelli?
Yeah, I just say that we don't know what we don't know. So if it's because we're not looking, we're clearly not finding it. Or, you know, I shouldn't say we because I'm a veterinarian. So maybe the medical side of things, they're just not looking for it because it's not on their radar. It's not on their differential list. I don't know, but I definitely think that yeah, it needs to be investigated a little bit further. But at the same time, coming back to Dr. Hart's presentation, you know, if you're trying to find something, you have to have a test for it, and you have to have an accurate test. And so, if that is one of the disconnects, what is the push to develop a test when you're not really seeing a broad impact? You're not seeing thousands of people getting sick from this. So, what's the motivation to start looking if you're not looking yet?
Interesting. Anyone want to comment? Attendees, panelists? Dr. Hart?
So I think some of this could be, well, so I want to kind of back up on the test and the accuracy of the test. So we talked about cross-reactivity, and there are ways of getting around that. You can use recombinant proteins, you can use special kinds of blocking agents that kind of help prevent that. But I think some of this comes down to the fact that we really just don't know enough about this organism, because a lot of organisms, if we know the shedding pattern of the organism, we can use PCR testing to say, okay, that animal is no longer shedding. It is not at risk. It's not putting the population at risk. So it could be, if we knew more about E. caniculi, and this kind of goes with what we were kind of talking about earlier, that more studies need to be done. If we could figure out how E. caniculi is shed, is it an intermittent shedder, or is it, do you get it, you seroconvert, you're done? You know, can we use that information then to test animals and say, okay, this animal has been tested negative by PCR, or, you know, seroconverted by serology, whatever the testing assay may be, and then saying that, you know, it shouldn't shed again. I mean, I think that's the piece that we're really missing here, is that in the absence of information about the biology of the agent, we're sort of like speculating. I mean, we have these tests at hand and we know that they work based on, you know, positive and negative controls that are developed, or what little studies have been done, but we really don't know, you know, a lot about this agent. And I think once we define the pathogenesis and really understand what it does in guinea pigs specifically, I think we'll know more and be better able to apply the right test and the right sample type to get to the answer that we want to address.
Hey, thank you. Got another panelist up, Dr. Ritchie?
So are you saying then, Dr. Hart, that the medical profession writers have a better perspective of a definition of zoonosis and better understand what tests results mean in pathophysiology than our veterinary colleagues do?
No, that's not what I'm saying at all. I'm just saying that we are lacking information to best address the situation at hand. Like, how do you, yeah, we just need more studies on the animal pathogenesis side to be able to say definitively, okay, do test X, and this animal is now safe to give to that immunocompromised child. I think that's what this all boils down to, is the risk that whoever was buying the animals felt, and then how to mitigate that risk on both sides of the aisle.
Thank you. Dr. Campitelli?
I just want to say that I really appreciate you saying that, because there's so much that we don't know. And that is one of our overarching goals for putting this conference together, is that we at the government, we don't have the authority or the resources to dedicate to learning and finding out these answers. So that's why we need you. We need you, the audience, who have the tools, who have the manpower and the money to spend to be able to put a project together to help us find out these answers so that we as policymakers and regulators can then make informed decisions and not just those knee-jerk reactions.
Thank you. Dr. Ritchie?
Yeah, so I'm going to go back to you, Dr. Hart, and you know, this is all friendly. I'm just looking for. I've been thinking about it since I found it. Is why? So, if your response could be then that it's us who has a better understanding of those risks because we're dealing directly with those animals, those patients, to the human infection. And is that the difference? Is that we have the better perspective than the medical or human infectious researchers?
No. I'm not saying that at all because I honestly don't know the answer to the question because I really don't. It goes back to, I really don't know. Who knows the best answer? I think just in general, if we're trying to give advice to producers on what they're going to do with their animals and give advice to buyers on what they're going to do with their animals, all I'm saying is that I think that we need to know more about the disease pathogenesis of the agent so that we can appropriately assess the test results that we get and then the actions that we take. That's all I'm saying. I don't know. I don't want to say physicians know more than veterinarians, and I don't want to say veterinarians know more than physicians because we are all medically trained, and I like the concept of One Health. I think more needs to be done with this agent because I agree it's everywhere, but what does that mean? I don't know what that means. I'm going to be 100% honest. I don't know.
Okay, do we have any additional comments from the attendees or panelists? Not seeing any hand raised. We kind of already touched base on this, or at least we started the conversation on it. So we're going to go a little bit further into it. What are the gaps in what we need to know about the risk of zoonotic transmission of E. caniculi in positive guinea pigs, and how can they be addressed? I think you guys have covered a lot of that, but we're going to open it back up to the panelists. Dr. Hart, it looks like you want to start.
Sure. And I just want to echo kind of what I mentioned before, because in my mind, I think if we had a better understanding of when the animals are shedding, do they actually clear the pathogen? You know, it gives you better guidance on how to interpret the test results and how to tell people on how to handle the animals. Also, you know, kind of what's already been raised as far as risk goes. Presumably, you know, we're getting exposed at any time. So what does that mean? And so I think I kind of go back to looking at everything from everybody's angles and trying to understand this. But like from a risk mitigation, if I am potentially, you know, selling an animal to a client that may be using it for as a pet scenario, I think I would want to make sure that that animal is not posing an additional risk to that particular individual that might be purchasing it for a pet, for a child. So I think if we understood the pathogenesis, we might be able to make better recommendations on how to handle animals that, you know, are positive or exposed or whatever that looks like. So I think we just need more studies, or at least more data on the cases that we have at hand to better make stronger recommendations one way or the other.
Thank you. Mike Bober, you want to weigh in on this?
I mean, I in a lot of ways I agree. I think you know, what we don't know is the challenge, and I think that the approach really is more about being willing to admit that we don't know things rather than trying to kind of fake it till we make it, so to speak. I think a lot of the challenge comes down to, that willingness to be vulnerable and to show that, we may not have all the answers and there may be mistakes being made, but, if breeders are operating from a position of risk or fear that that not having the answers is somehow going to be a death sentence for them, then that makes it very hard to have those open and collaborative conversations. And I think that I've always believed that the purpose of federal regulation of agriculture is to do what we can to do what's best for the health and well-being of the animals, and not to punish people for getting it wrong, but rather to work with them to help them to do it the best they possibly can, and then to step in if things are happening out of willful neglect. So I think there needs to be a continued reinforcement of the fact that not knowing an answer isn't in some way an indication that you're a horrible person, and how dare you even be in this business if you don't know what the answer to this is. I think it really does speak to a need to have everybody trust that we're all working on this together, and I think that's a trust that's eroded over time, and it's going to take some work to get back to it. But I think it starts with everybody kind of putting aside a little bit of their suspicion of the other, and accepting on face value that everyone is here because we care about animals.
Thank you. Bob Markman?
So when we actually had human cases with salmonella associated with guinea pigs and ringworm, we were able to trace that pretty easily. And public health got involved and tried to take samples of water, soil, bedding, feces. It was still hard to find it at the breeder level, but they did find it, from animals that were positive at the pet store level. It's not true with E. caliculi because we're kind of treating all zoonotic diseases the same. And so it's not like people getting it that we know of that got infected from this. And without that information, like public health is not stepping in to, try to take samples. So this testing is not cheap. And if serology is not the way to go and we need urine, there may not be that many breeders left in the near future, the way things are going. So not sure, where the pets are going to come from, probably at shelters for a while. But I don't see, this E. caliculi seems to be being treated worse than how salmonella and ringworm were treated several years ago.
Thank you. Dr. Radside?
I think there's probably more unknown than is known, and I think that's part of the problem. So I think to try to list all of the gaps is probably impossible, but to me, what does a positive guinea pig mean? What is the risk of that? Is that an animal that was just exposed at some point? Is that animal actually diseased and at risk to transfer something to somebody? I think that's a big question. And I think until we answer the question in the pet industry, I guess, their biggest question is, why have we suddenly had this increase in positives? They said they've been doing this testing for years, and that's, I guess, what spurred this whole thing. And that's a question that they keep asking when we have these meetings. So I think probably until we're able to answer that question for them, they're just going to continue doing what they're doing. So I'm not sure how to answer that question. I mean, have things changed that much in the guinea pig industry to have this spike? I don't think so. I didn't see any big changes. They say the test is the same. I don't know about that. I would think that over time, the sensitivity and the efficacy of tests increases. So could that be the cause? I don't know, but I think figuring out the answer to that is probably going to be key to resolving this a little bit.
Okay, Dr. Campitelli?
Yeah, I think everybody's done a pretty good job of talking about what are the gaps. So I think I would like to say a little piece on how we fill the gaps. I look at, COVID, our approach to COVID was we invested a lot of money in figuring out all these questions. And we are not in a position to be able to put up the funds to have that investment and have that push those projects forward. So I really feel like either, we band together and we get everybody involved, we make it a true One Health concern, and we use the guinea pig breeder industry as, our poster child to say, look what we have done to them. Half of them have gone out of business. We need to figure out why, and either help them, which sometimes is not possible. I know, like I referred to the foot and mouth disease, and Newcastle disease with what we have at a foreign animal disease outbreak. We talk about indemnity. Sometimes it helps, sometimes it doesn't. But we can band together and try to raise the funds, or we find someone that can be, their angel investor almost, to say, look, here's what we want to know, and we have the funds to try to make that happen. It's just it's not coming from anywhere right now, and we need to make it so in order to answer these questions.
Thank you, Dr. Ritchie.
Yeah, we take 30 animals that are seropositive and sequentially put them somewhere and sequentially test them until they succumb to some natural disease process. And then we do pathology, histopathology, and take them apart looking for microsporidia. We take 30 that are shedding whatever PCR or amplicon we can get and do exactly the same thing. And then we take 100 animals out of the veterinary community or out of the retail system that have some type of any of systemic disease processes that the Poland folks described, and that don't make it. And we do pathology, histopath, and take those animals apart looking for microsporidia genetic material. And then we'll have the information we need to qualify a compendium that would be correlative to solving the problem. People would understand what it really is or isn't in the process. Can't do this when our HIPAA laws are quite problematic. You'll see I have nothing from humans with microsporidia, but the other one is to do surveillance of veterinarians versus the general population, pet store workers versus the general population, similar to what they did in Czech with general population and slaughterhouse workers, and see what the seroprevalence difference is in those groups, and do a dog and cat group versus rabbit and guinea pig owners. Going to Dr. Campanelli's cost issues, the infectious disease lab can cover the cost of the PCR. We already have. We've spent quite a bit of money and time trying to get a test that could be used commercially, functionally in the industry to help establish the status of an animal. That's been quite problematic. Dr. Cray said she'd run serology and not charge. So then it's where do you house the animals? If somebody can house the animals and we don't have to bring them into a lab animal facility, then that cost goes way down. If we have to bring them into a sequestered area of the lab animal facility, that's expensive. So then the only cost we have is that we can't write off is us doing the pathology and histopath. So the budgetary cost go down if the animals can be housed. And Dr. Craig continues to be interested in doing the serology. We'll certainly do the PCRs, but that'll give us the information that we need. And it would be a natural way to strengthen what was found in the Poland paper in combination with the experimental infection in the rabbit, and give us some insight that we don't have, and I think would help the whole industry.
Thank you. Dr. Adsai, you had a comment?
Actually a question, just kind of following up on this funding discussion. And also, you know, Dr. Ritchie's comment that the best way to kind of proceed would to be develop a compendium like was done with chlamydiosis. So I'm just curious, in that situation, how was that funded? Can we learn something from that as far as for this situation?
Dr. Ritchie, did you want to respond?
Yeah, those were funded early on by the CDC. I think there was a transition at some point in time that maybe one of the public health groups or the National Public Health Veterinary groups picked up some of the funding or all the funding. And I'm not exactly sure in the 25-ish year history of that group when that transition occurred. But when the original meetings that I went to, the expenses were sent through to CDC and they covered it. I believe we had some CDC folks on the original calls with this E. caniculi piece, and we asked this question because at that time that would have been the best thing to do. Is the immediate thing that I thought we should do is get a compendium in place with what we do know. It guides what we don't know. It guides what we need to know. But there was not any funds to do that. If I remember, it was about 30,000 to pull everybody together and do one of those compendiums. I'm actually changing I think that would have been the thing to do 2 years ago to maybe have stopped some of what we've now faced by having everybody on the same page. But today, I think you saw the summary of how little we know, what we don't know. So I'm not sure that it makes any sense to say that again. I think the point now we need to define is working out what seropositive means, when they shed it, when they don't shed it, and then what that means to their clinical status to the point of natural death. And then we can do something with a compendium to correct the misconceptions about whatever term we use to replace zoonotic.
Okay, thank you. Well, if no other panelists have their hands up, I'm going to open it to the attendees. Any of you that have been impacted by it, any of you doing testing, anyone have any comments or concerns with any of the gaps or any of the shortfalls that they had to deal with in dealing with E. caniculi? If so, please raise your hand or put the question in the Q&A section. Okay, not seeing any hands. I'm going to turn it over to Dave for a question that came in the Q&A.
Sure, we have one. It says, how aware / concerned is the general public?
Panelists, do you want to respond?
I mean, I can only speak anecdotally, but this is something that is very much inside baseball from where I stand. And I think the kind of further supporting evidence of that is the fact that if you really were to do any just sort of casual internet searching out there about guinea pigs and caniculi, there's almost nothing out there right now. This is not being talked about outside of professional circles, but that doesn't mean it's not an important conversation to be having. I think if we can frankly get ahead of it before, or catch up to it, I guess is probably the better way to put it. As a group that is committed to working on this, I think we go a long way toward avoiding this becoming something of a panic if people kind of get half understandings of what's out there. I just don't think that it's been communicated much to the public at all.
Thank you. Bob Markman?
I have to agree. I don't think the public is aware of this. And one of my breeders tried to he stopped in recently at a major chain and said that he wanted 6 guinea pigs. And they said, well, there's none available. Well, he's actually a breeder, but he goes, well, when will you have them available? I need 6 young guinea pigs. And they said, well, we might be getting a couple in a couple weeks. We can call you. He goes, no, I need 6. So I don't even know if the stores know why there's none in the stores.
Thank you. Dr. Campitelli?
Yeah, I think it's weird because it's almost like the reverse of where we normally find ourselves as veterinarians and in the veterinary community. Like normally our communication is, there's a big problem, so you need to be aware of it. Now it's almost like the opposite. Like, hey, there is this problem. We need to know more, but it's not really a huge risk necessarily. So I think that we are not willing to say a lot about it because we don't want to raise the flag more higher than it's already been raised. But at the same time, there is definitely a clear gap and that needs to be filled with information. So it is tricky to start having that conversation to say, yes, it's had an impact. I think that if the stories continue, like Bob shared with the news articles and the news stories about the pet ban, I think if e-cuniculi was potentially tied with those, we could start maybe piecing things together. But I would be hesitant to just, pull the bed sheet off of everything as it were, to just say, expose the whole thing and say, and draw more attention or draw more scrutiny, I should say, because it does seem like it's almost the opposite. Like there doesn't seem to be a huge reason for concern other than the effect that it's having on these breeders.
Thank you. Dave, we have another question that came in.
Yes, we do. If there were a definitive treatment, then the pharmaceutical company might behind it might be interested in funding one or more studies. But what are the panelists' thought on the potential approach of working to resolve some of the knowledge gaps?
Dr. Radzai, you had your hand up before. Did you want to take a crack at this or respond to the last comment as well?
Yeah, I was just gonna say, I think the reason that the public is not aware is because most of the time these situations, you'll have illnesses in people, and then that's the point at which you start to investigate backward to animals. I think this has been kind of a backwards situation where we're using this screening test for years. Nobody knows what it means. We start seeing positives, and even though we're not seeing effects in people, we're all of a sudden, it's a big problem. We can't sell these animals, so it's really, I don't want to say making a problem out of something that's not a problem, but it kind of seems that way a little bit to me. As far as treatments, why would you treat an animal that's not sick? And especially if we're not really sure what seropositive means, if it's even a risk. So to put a lot of money into that, I'm not sure that would be the best approach.
Okay, thank you. And so the next question kind of ties in with what you guys have already been saying. There's not a lot of communication out there, but what is out there may not be consistent. And so how can we make sure that this is improved and consistent messages are given? We'll start with Mike Bober.
Consistent messaging is always going to be a problem for us. I think, that comes from the fact that we're not always sure exactly what it is we're trying to be saying in the first place. But the other challenge we have, and we saw this last year when we were trying to gather folks for the webinar, is that this is not, we've referred to it a couple of times now as the guinea pig industry. This isn't an industry like the automotive industry. This isn't something where you can, reach out to the CEOs and have them, kind of send out an all staff email. Most of these breeders are individuals or families, small scale operations that are not, in some cases, even technologically plugged in to the point where we can put out an all hands memo. I don't envy USDA at all for your need to communicate with stakeholders. I mean, I feel like you've got to do everything from sending carrier pigeons all the way up through Morse code, and so I think the challenge for getting any sort of concerted and well-organized communication in place is the challenge of communication in the first place. This is not anyone who imagines this as a well-organized, phone tree kind of situation has obviously never tried to bring people together around one of these issues. It really is, just shoot it out every way you possibly can, and know full well that you're probably still going to miss about 20% of the people you need to talk to. So I would say it's the biggest challenge and the real need here is to kind of find ways to streamline that process so that we continue to improve on the job that we're doing of bringing people together and getting them that necessary information as quickly and accurately as possible. And I have to apologize, but I actually need to jump off now. This has been amazing. I really appreciate the opportunity to be part of this, and I do hope folks follow up with me offline to continue some of these conversations. Dr. Campitelli, thank you so much for including me in this.
Thank you for being here, Mike. Appreciate it.
Absolutely. Y'all have a good day.
All right, and Kathy, you already have your hand raised and you're off mute, so go ahead and you can respond.
Yeah, I had to laugh about the carrier pigeon comment because it's true. To invite, the people that we wanted to reach in order to let them know about this conference, we sent about 100 letters by standard mail. We did follow-up calls. Bob and Christina put in hours on their phones, announcing it, mentioning it every time that they were at an inspection at a guinea pig facility. So it is a challenge. The other thing that I was going to add to what Mike said was that we have to accept, however we design our communication strategies, we have to accept that it's going to take some time because you're not going to reach the entire audience the first time you say it, the first time you put it out there. So it takes time. And I have this experience with working with the dog breeder communities. I've been going around to different states and their different dog breeding organizations for about a year, saying the same messages. And I keep getting the same questions because they just haven't heard the answers from the first meetings that I was at last winter. So it takes time. And so in order to make sure that a consistent message is out there, you have to be patient and you have to resist the temptation to always improve and always get the most current and accurate. You have to stay consistent.
Thank you. Dr. Radzai?
Yeah, just wanted to further elaborate on the challenges of communicating with the breeder community and, no offense to how this meeting was organized, but for most of our breeders that are Amish, they're not going to have computer access to be attending this meeting. So they would have to attend by phone. And most of them have a phone that's basically in a shed outside their house. So they would have to basically stand in that shed. It's pretty warm out this time of year for, the duration of listening to this. So, and with it being during the day, most of them are working. They work on farms. They're, you know, out in the field. They can't take those hours in the day to spend 8 hours in their phone booth listening to something like this. So, I mean, I was contacted by the breeders in my area who are organizing their own meeting, and it's going to be an evening for a few hours. It's going to be locally. Unfortunately, I can't attend, but I think the broker is going to be meeting with them and conveying some of what was discussed. But so you can see just what the challenges are as far as communication. Definitely difficult.
Thank you. Bob Markman?
Well, I think most of it's been said. I wish I would have had some literature that I could provide that would have been helpful in this situation, but I think some of the literature I looked up would have made it worse. Some of the literature even says it's still a parasite. So the breeders wanted to know if they were at risk and can you share information? They were concerned. So yeah, I wish we definitely need more research, but I wish I had better resources to give them.
Thank you. Dr. Ritchie?
Yeah, compendium. But I'm going to back up to the question about the pharmaceutical question. If there was a company that had that funding, then we had 2 more groups to our evaluation. We take a group that has some clinical signs and are serologically PCR positive with clinical disease, and a group that isn't, and we treat them with albendazole and follow those animals through till their demise. Because the albendazole data that's available in humans is that you treat them, they get better, you're not able to pick up the spores any longer, even in highly immunosuppressed HIV patients that they followed out for a year. I'm assuming that they lost track of those people. They may have lost those people in that 3 to 14 months. But it would be worthwhile to see if that's the case. But I do agree, you don't use that drug in an animal as a preventative. You use it as a treatment, but we need to know what happens after you take a patient that is known positive and you treat them.
Thank you. Dr. Hart?
I don't think I have any more to add that hasn't already been discussed. I guess, and maybe this isn't the right time to think about this, but I'm just sort of kind of thinking about it, so I'm just going to kind of say it. But, you know, while we wait for a compendium or other experiments or whatever we need to do to help make a definitive decision, I guess what can we do moving forward today that we could try to apply? Does anybody have any thoughts or ideas or, you know, anything that they want to kind of pose?
Okay, Dr. Campitelli?
Well, I don't have another answer to the question. I was just going to further push it to people in the audience. You know, I would almost ask, you know, it seems like the stopgap in the market chain was at the pet store level or maybe the broker level. I don't know. So I think a question would be, what do you need to know to be able to adjust your decision? What would make you more comfortable to start buying again?
Okay, again, if you want to respond to either of those, you can put your hand up or put it in the chat or the Q&A. Dave, I'm going to pass it over to you, seeing no hands up.
Yep, got just a couple for you. So the first one is, how do you view the impact of COVID-19, the COVID-19 pandemic on society as contributing to concerns about animal source of caniculi and impacting human health?
Dr. Campitelli?
We're tired. everyone has COVID fatigue. And I think that is definitely one of the variables that is the unfortunate timing of this whole issue, is that we've just come off of this horrible thing that, yes, it stemmed from animals, but it had such an immense impact. And now here's something else that's coming from animals. I mean, again, the same thing with mpox, monkeypox. You know, it was kind of a blip on the radar. Nobody really paid much attention to it because it did impact people. Some cases severely. I saw news stories of people that were infected, and it was severe for those cases. But it never really hit the radar. I mean, internally, we talked about it some. I was on a few calls, collaborative calls about it, but it seemed like it wasn't as big of a deal as, you know, maybe it should have been. And I think that's because of the COVID fatigue.
Okay, thank you, Dr. Ratzai.
I'm kind of a different perspective. I'm not sure that COVID itself really had an effect in this case. I mean, maybe that was in the back of someone's mind, but I think more COVID had an effect on the market with, you know, causing such an increase in the market and then kind of being glutted, I would say. And then, you know, now having dried up so much afterwards, I just wonder if that played a part. Just the decreased demand for guinea pigs makes it a little bit easier to start refusing animals. That's just speculation on my part. To me, just hearing the pet store representatives talk, it's just sounds more like an issue of all of a sudden they got these increase in positives and they're really worried a lot about lawsuits. So that's just, which to me is not really related to COVID. So that's just my perspective.
Thank you. Dave, we have a couple more comments.
Sure. To Mike's point, could agricultural extension offices and/or state veterinary medical associations be part of the communications chain for this relatively dispersed community?
Panelists, we have any comments? Dr. Campitelli?
I would say probably not, because, you know, when they were first being told about it, they were talking to Christina, who then talked to me. And I reached out to, you know, the veterinarians, their clinicians. And I don't know, maybe that was an oversight. Maybe we should have involved the state VMAs a little bit more, but I really think it's such a cloistered community. You know, there's maybe 2 or 3 veterinarians who are even working with these facilities. So I don't know that involving a larger organization, I mean, to bring awareness, maybe, but to actually, you know, assist with the communications, it's almost like word of mouth at this point. It's such a small community.
Thank you. Seeing no more hands up by the panelists. Dave, do we have another comment?
Sure, this one's kind of long. When this all started, no one had the answers. There was a perceived risk to human health. The situation was compounded by no communication with the breeders and the other industry members. Now we have had time to do our homework, the literature review, and the risk to human health seems to be less than originally thought. No one wants to be the one to provide these pets for the public and then realize they were wrong and find there is a human health concern. The risk or the question becomes, how can we prove there is no risk to people? That is what will change the market. What Dr. Hart said, we need to understand the pathogenesis and have the data to back it. and then communicate appropriately.
Thank you. Panelists, do you want to respond, Dr. Hart or Dr. Campitelli? I know you both kind of mentioned this or touched base on it or challenged the brokers to put their comment in. So either of you have a comment? Dr. Hart?
Yeah, well, I think that might be where the point that we're at, if that's what people need to feel comfortable, is, you know, in the absence of the CDC coming out and saying that this is completely acceptable, people are safe based on the human literature, wherever that's going to go, then perhaps having this information, you know, on the compendium is the guidance that we need to make a definitive call one way or another on what a positive result might mean and what risks or not risks are associated with that.
Thank you. Dr. Campitelli?
Yeah, I would agree. And almost to the point of, I don't know, a consumer interest study or something to that effect, because, you know, there are a lot of other agents that people can become sick with that they might acquire from their pets. And we haven't stopped selling animals because of those things like E. coli or salmonella. You know, we do our due diligence to trace them back and say, here's where it came from, here's where we can do better. But it never interrupted the market like this. And so I almost come back to Christina's point that, you know, it may not necessarily be all hinged on this infection issue. Is this really kind of hiding the true issue that it was a boom and bust situation? And yes, coincidentally, this seropositivity has increased. And so, you know, we've always had this longstanding policy that we don't accept E. cuniculi positive animals. But it was never enough to interrupt the market as much as it has to this point. So I would almost say even, you know, providing some information and letting a consumer decide, you know, is this a risk that I'm willing to take before I buy this animal? Yes or no? Maybe that could garner some data to make a decision moving forward. I don't know.
Thank you. Seeing no additional hands, David, you have another comment?
Yeah, another comment. Normally you decrease fear by telling the audience what they can and should do. In this case, the objective evidence is rather sparse to enable the usual risk communication approach.
Panelists, any comments?
Yeah, hence why we're here. I hate to keep saying it over and over again, but we need answers, and we don't have the tools. I mean, in the USDA and we as an organization, we don't have the tools to answer them.
Thank you. David, do you have another comment?
Sure. This is a question. One of the presentations noted that guinea pigs were banned in certain states due to too many of them in shelters. Do we know if this was all related to E. caniculi? Is there data as to why so many guinea pigs are ending up in shelters?
Dr. Radzai?
I don't have data, but this is my speculation or assessment of the situation. Again, like I said, during the pandemic, with everyone staying at home, people were it was a boom of buying animals. Guinea pigs was included in that. The market went crazy. I licensed, you know, so many new breeders. The prices were higher than they've ever been, like historical high prices breeders were getting for guinea pigs. They were just breeding like crazy. People were buying them like crazy. Then the pandemic stops. Okay, people are going back out into the world and not stuck at home. They don't want to be stuck with these pets to take care of. They don't have the time. They're out doing this. They're not stuck at home anymore. That's just my kind of assessment of why I believe. And I don't think it's just guinea pigs. I think it's maybe even spread to like dogs as well. The dog industry has kind of collapsed a little bit as well, not quite as much as the guinea pig industry, but as people get back to their lives, get back out of the house, I just feel like that's why more animals are ending up in shelters.
Markman?
So not necessarily states that ban them, as far as guinea pigs, but as far as cities, yeah, you could see an increase about 20, probably part of 21, 22, 23, like I gave the data this morning, at least in New York City, where they were ending up in shelters. The big issue is these shelters have policies that they have to spay and neuter these animals. So to spend an average of $400 to $500 to spay and neuter a guinea pig is a big expense. And if you had maybe 200 before the pandemic, back in 2019, and now all of a sudden you have to spay and neuter 600 to 800 guinea pigs before you can adopt them out because that's your rules. I think they have to just get to a decision like, what are we going to do with them if they keep coming in? So some point it's going to level off because if the pet stores can't sell them, in a few years, it will go back down, but I'm not sure the ban would be lifted.
Thank you, Bob. Dave, we have another comment.
Sure. Next one is just a comment. I would like to see a better alert system to breeders, brokers, and pet stores.
Okay,
Great idea.
thank you. Dave?
And we have one more. Why haven't rabbits been positive? Being positive caused more of a scare than guinea pigs.
Dr. Campitelli?
Yeah, I'll start that one. I think that the difference between rabbits and guinea pigs hosting and carrying this disease is that you can pretty well look at a rabbit and know that it's infected with this thing. Guinea pig is not the case. They're subclinical, so you can't easily tell. So, and likewise, the response to treatment, the treatment might be expensive. Is it worth it to try to treat? So there's a lot of different factors here, but I think overall, I don't know what the seropositivity rate is in rabbits. Maybe Dr. Ritchie covered that in his talk and I've left it already. But I would point to the clinical appearance.
Thank you. Dr. Radzai?
I don't have an answer for that. I more have a question. That's my question is, are they testing other species that they're selling for pets? Are they testing dogs and cats? I don't even know. Are they testing rabbits? Dogs can be positive, cats can be positive. Why are guinea pigs the target of this?
We have several veterinarians out there in the attendees. Anyone have any suggestions or comments to that? Okay, not seeing any hands or additional comments or questions. Dr. Campitelli, I'm going to turn it over to you to close everything out. And we want to thank all of the panelists time and time again for all of the efforts that you guys have put in to be here. Dr. Campitelli?
Yeah, I would just reiterate, thank you for everyone who has participated and attended. Thank you to all of our panelists. We're looking forward to another great day of presentations tomorrow. So please don't forget to reach out to any of your speakers or your fellow attendees on the Whova app. And if we're all done here, we will see you back tomorrow. Thanks. Have a great Friday evening.
Okay, 9
Thank
a.m.
you all.
tomorrow. Please be back.
Thanks all.
Bye all.